This is Late Night Health. I'm Mark Alyn, along with Gary Stewart, and also the insane Daryl Wayne. We have Dr. Leo Doumanian on our phone. He is on vacation in Chicago, and he is kind enough to talk to us about edcure.org, edcure.org, for information on male sexuality and male sexual health. Doctor, we were talking, about the pump system that can help most men who have erectile dysfunction of a certain kind. What about the psychology of having the pump? Does it bother some men? Does it not?
Well, that brings up a great question, okay? Because a lot of guys, when presented with the option of placement of inflatable penile prosthesis, will be turned off by the sort of aspect of having an implantable device. Once you sort of discuss with them that putting this prosthetic in will, in the long run, improve their sort of self-esteem, that will improve their love life, will open the world up, because of many of these men, because of their sexual shortcomings, sort of become very insecure, that the psychological aspect is certainly easy to overcome. And that especially is contingent upon your relationship with the patient. You have to spend time and talk with them. The insecurity is before you get the prosthetic, and a lot of times it's the failure of the erectile medications and the injections. So when they're with me, they're usually past that point where they want to, boost their self-confidence rather than questioning their self-esteem at that point.
But using the drugs, I mean, there are side effects from the drugs. In fact, on the Viagra commercials, it says, death can happen. Instant deafness, blindness,
right,
etc.
Exactly.
Right?
From the capillaries.
Right. And so my question is, are there side effects from a prosthesis?
Well, anytime you have surgery, you have risks and benefits. And if you're an individual who wants a penile prosthesis, you have to weigh the risks and the benefits. More often than not, the benefit of having a penile prosthesis placed far outweighs the risks. In this day and age, with surgical sterile technique and the impregnatable antibiotic coating that is placed upon the prosthetic, the risks are few and far between. I like to talk with patients about the risks that include, but they're never limited to, because the surgery is oftentimes never 100% certain, but the risks are minimal in the sense that you can have bleeding and infection, but that's any time anyone puts a scalpel to your body. We give antibiotics. We use extreme sterile technique. We use lots of maneuvers to reassure that the environment is as sterile as possible. Other side effects can include unsatisfactory cosmetic results. What does that mean? Sometimes an incision will heal at the skin level and need a little cosmesis down the road. Sometimes men will feel that the prosthetic will shorten their penis ever so slightly. That's another risk. Men have a tendency to overestimate the size of their phallus prior to having the surgery. So you have to engage in that discussion as well. The biggest risk of having this procedure is infection of the prosthetic, just like any hip or any heart valve. If that happens, then you have to remove the prosthetic. But in this day and age, we've gotten so good at the throughput and the procedure and the protocols and the antibiotic coverage that you see that no more than 1 to 3% of the time.
Well, it seems to me that if you want to have a sex life and you can't, that this would be something that most men should take a look at. I mean,
absolutely.
Absolutely.
Not only that, I've had many men who come back to me and say, "You've saved my marriage, you've changed my life. I've seen the wonders of the world once again. I've gained confidence. I'm doing well in my job." Self-esteem is something that feeds into all aspects of life.
And I can't wait to hear about the 80-year-old Randy men who come to you. We'll do that next time. Doctor, thank you very much for joining us. Be sure to stop by edcure.org if you'd like more information. edcure.org if you'd like more information. All right, coming up next, it's you on the hot seat, Gary.
Okay, wonderful.
Gary and I will be talking about constellation therapy coming up next here on Late Night Health. If you don't get the second hour of Late Night Health, join us at latenighthealth.com. That's latenighthealth.com. More coming up. Don't go away. We'll be back around the corner.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.